This is a really big shift, and this comes as companies everywhere are scrambling to stay in operation with workers getting sick. Now the CDC's new guidelines are slashing the quarantine period and even keeping some out of isolation completely.
We went from a fully negative staff, and we had our staff tested pretty regularly, to almost 90% of our staff testing positive within a period of a week.
Restaurant owners hungry for workers, healthcare staffing at low levels, airlines canceling thousands of flights over the peak holiday season. Businesses are taking big hits to staffing because of the Omicron variant and workers forced to isolate. Now the government's slashing that requirement to get workers back in half the time. Monday, the CDC updated quarantine guidance for all, saying science shows most people are infectious the 2 days before and 3 days after developing symptoms. The new guidelines: everyone should isolate for 5 days. That's cut in half from 10. If you're symptom-free after isolation, you can return to public life, but should wear a mask for 5 more days. If you've had close contact with somebody who's COVID positive, you can quarantine now for 5 days instead of 10. But if you're boosted, no quarantine needed at all. The move coming after pressure from airlines and other businesses. Delta Airlines CEO pleading with the CDC with the rapid spread of the Omicron variant. The 10-day isolation for those who are fully vaccinated may significantly impact our workforce and operations. That playing out across the nation's airports with end-of-the-year holiday travel, stranding holiday travelers as Omicron hits staffing hard. Outside the skies, similar stress closing restaurants.
We're dealing with a much more transmissible strain that has a larger impact on the business, but we don't have those backstops that we did before.
Broadway shows, too, have been shuttered, as well as pro sports games postponed. So many changes for so many of us, and many medical experts applauding the CDC slashing of that isolation period. But some say they wish the CDC would have recommended a negative rapid test before telling people to end that isolation period. Live in the newsroom, I'm Kirsten Cole. Back to you. And of course, Hazel, people could take that on their own.
Oh, definitely. Thanks so much, Kirsten.